name's Robert Norton. I'm an orthopedic spine surgeon. My patient care philosophy is to treat every patient as I would a family member. So when someone comes in to see me, I treat them as if it was my sister, my wife, or my mother. And I truly think that's how we get the best results. Because I say to myself, what would I do for myself? What would I do for my wife? And that's how I want to treat every patient. To be able to dramatically help someone that was in agonizing pain and couldn't walk because they're in such severe pain and rid them of that pain, it's life-altering. To take someone that was going paralyzed and that they can walk again or losing functioning of their arms and allow them to use them again is just inspiring. An important concept for patients to know is that our practice is a comprehensive spine center. Our goal is to take care of our patients in whatever way that needs to be. So that's why we have an orthopedic spine surgeon, we have a neurosurgeon, and interventional pain management doctors. The reality is the majority of people do not need surgery. And these are patients that sometimes can be improved just with physical therapy, with various types of injections, with different anti-inflammatories or pain medications. And surgery is always a last resort. So if we can get rid of your pain and you can live the lifestyle that you want to live without surgery, then generally that's fantastic. If it gets to the point where you're not doing well or there's a neurologic emergency, then we need to treat more aggressively with surgery. And in those cases, I think it's important for all of our patients to know that we'll treat you like a family member and we'll always be at your side. You have to treat each patient as an individual, and they each have different types of problems that need to be fixed. And because of that, we have to approach the problems in a different way. So all of my patients, if they're going to have surgery, we collect digital outcome measures for our patients. So they all fill out an iPad that has standardized tests, questions to answer before surgery and after surgery. And that allows us to conduct research to say, is what we're doing effective? Is it helping the patient? And that's why I can do so many different types of spine surgeries to make sure I'm addressing the appropriate problem and fixing what needs to be fixed. So my goal is to better that fund of knowledge to allow our patients to have better outcomes. I enjoy every aspect of spine surgery. You know, I enjoy the very complex deformity, revision, reconstructive spine surgery. I enjoy the complicated cases because those are the things that it's difficult for people to handle. And I enjoy being able to take a patient's complicated situation and fixing them. Because a lot of times patients are told there's no help for you, you can't do anything for it. Or I get referrals from other doctors to fix very complicated issues. And you know, it's a lot of work to do some of these big cases, but it's a lot of reward in the end. The other side is I really have a big passion for minimally invasive spine surgery. That's the cutting edge future of spine, right? So to be able to do the same types of surgeries that people have been doing for years using little windows so we don't disrupt much tissue and very, very little disruption to the muscles of the back, and to do everything in little windows is an amazing opportunity that we couldn't do 10, 20 years ago. But now with technology, we're able to do these types of operations that people would stay in a hospital for weeks for, and now they can go home the same day. It truly is remarkable. So this gets patients back on their feet quicker, gets them back to work, back to enjoying their lives faster. Part of the healing process is not just the surgery, but it's also knowing that someone's there for you. It's not just surgery, it's also the art of medicine that needs to be included when we talk about healing patients.